Good morning, Black Health Matters family. Thank you for joining us this morning. My name is Leslie Fontenot. I'm the Managing Director for Black Health Matters. This morning's conversation will be with Dr. Patrice Harris. Our talk will be on mental health, hospitalization, and being vaccinated. Poor mental health could negatively affect how well you get along with family and friends, your productivity at work or school, your interest in activities, social settings, and other situations, along with your energy levels. As reported by Black Health Matters and the Mental Health America, in the United States, 16% of African Americans individuals have reported struggling with mental health issues in the past year. To put that into perspective, that is over 7 million African American people struggling with mental health. Dr. Patrice Harris is a psychiatrist here in Atlanta and has many honors and achievements in organized medicine. She was elected the 174th president of the American Medical Association from 2019 to 2020 and is the organization's first African American woman to hold this position. Dr. Harris has diverse experience as a private practicing physician, county public health director, patient advocate, and medical society lobbyist. Dr. Harris currently spearheads the AMA's efforts to end the opioid epidemic and has been chair of the AMA Opioid Task Force since its inception in 2014. Please join me in welcoming Dr. Harris to the Summit platform. Thank you for being here and thank you for all your work on the front lines, Dr. Patrice Harris. Thank you.
Thank you, Leslie. And let me just say, I'm so honored to be here. I know that Black Health Matters celebrated with me as I won my election and as I begin my term. And so I'm so pleased to be with you here this morning. I'm also particularly pleased that we are talking about mental health. I think we can all admit that even though we have made a lot of progress in the Black community, there's a lot of work to be done as we continue to talk about mental health and make sure that everyone knows that it's okay not to be okay. And it's okay to talk about our mental health because it is interwoven into our overall health. And so again, I thank you for the opportunity and I really commend you for elevating mental health. And I know that as we get on the other side of this, the acute side of this pandemic, and we will, I know you will join me in continuing to lead the discussion on mental health. So I have a few slides this morning. I'm going to talk a little bit and then I'll have an opportunity to answer some questions. So, as Leslie said, we are seeing increased reports of symptoms, anxiety, depressed mood, feelings of hopelessness, helplessness. Folks are more and more isolated. And so we really do need to make sure that we are laser focused on mental health in this country. And we have not been in the past after decades and decades of underfunding of our mental health infrastructure pre-pandemic. We did not have a solid infrastructure of services that we need. And of course, we know that communities of color had even less access to mental health treatment. I'll be talking a little bit more about that today. And we also need to realize that it may take months, even years, to really fully understand the impact of this pandemic on public health as well as our mental health, on our national psyche, on our nation's economy. I do have to say, and people ask me this all the time, am I optimistic? And I say, yes, I am pragmatically optimistic. The reason why I add the word pragmatic is because pragmatism requires action. For many years, we have been talking about solutions, and what we need to do is make sure that we are committed to act on those solutions. As I've said many times over the course of my career, okay, enough about the problems. We have the playbook. Let's talk about the solutions. But certainly as it pertains to COVID, we have 2 vaccines. And by the way, I have received my vaccines. I received the Moderna vaccine, both doses. So we have those 2 vaccines that have been authorized, and we expect today that the 3rd vaccine from Johnson and Johnson and Janssen to be approved. And so we know that there's no one size fits all approach here. You know, we've always needed a national strategy, and we've always needed all the tools in our toolbox. And so vaccines and a comprehensive testing strategy. One of the issues I worried about early on was I saw lack of equitable access to testing. So we still need a comprehensive testing strategy. And yes, we still need to wear our masks. We still need to watch our distances. We still need to be careful about gathering. So science tells us what works, and it is up to us to act on what works. And, you know, we will, again, as I said, get through this, but we will be in a transformed normal. I also like to say, you know, sometimes we say, when can we get back to normal? I would say for many, particularly in Black and Brown communities, we do not want to get back to BC before COVID, because this COVID-19 pandemic has really exposed so many fault lines. Many of us knew these, but it certainly exposed our lack of public health infrastructure, mental health infrastructure, as I've stated, but certainly also focus inequities. And of course, we've seen that not only in COVID, but in the concomitant crisis of unjust policing. Again, not new, but I think we can all agree that what has happened over the last year or so, because folks were not able to get on with their daily lives and were not able to look away, folks had to see what many of us have been seeing and talking about for years. But we know that there's a growing body of evidence around all of this data, and I'm going to talk a little bit about inequities and mental health today. But I do want to take a moment to focus on you. Yes, this slide has my photo, but you've seen and heard my introduction. So I really want you all to take a moment, take a breath, and put your photo in the place of my photo, because it is about you, right? And we need to make sure that as we are going about our day-to-day lives, that we take a moment to self-reflect and take care of ourselves. I know it's cliche, what we heard, the instructions when we used to fly, to put our own mask on first. And that is so important in the midst of a crisis. And I'll be talking a little bit about that, but I wanted to be laser focused. And every morning I try to take a moment to at least reflect on my mission for the day, and make sure that I am committed to doing at least 3 things to take care of myself. And so I do want you to remember that as we get through this pandemic. And actually, I could say, remember that beyond the pandemic, because we certainly always take a moment to take care of ourselves. So clearly 2020 was a year of a lot of uncertainty. You know, it's been about a year since we first began to go to shelter in place, and a little over a year since we had our first cases and our first deaths in this country. And I can tell you that at the beginning of this pandemic, we did not know very much. Why is that? People ask. This was a new pathogen. This was a brand new virus. You may have heard about the coronavirus family, but this particular virus, the SARS-CoV-2, was brand new. So we had scientists and virologists, public health officials have been thinking about this and worried about this, but certainly this was a new pathogen, a pathogen that was mostly transmitted through respiratory, through breathing in, through our lungs, our nose. And so this was new and we didn't know a lot. And I remember at the very beginning, and I was president of the AMA at the time, I told our team what we want to do is be clear about what we know. We want to be about the business of truth telling. We want to be transparent. And we also wanted to share what we didn't know, because it's just over the course of my career and even my patient interactions, my patients always are okay. Well, when I tell them I don't know everything, but they want me to be clear, be transparent, talk to them about the science. And certainly we did not know a lot. Now we've learned a lot. We have 2 vaccines. We know how to treat this. We have a lot more treatment opportunities than we did early on. But certainly a year of uncertainty, economic uncertainty, uncertainty about our jobs, uncertainty about school, work. Certainly 2020, everyone was ready to turn the page on 2020. Now 2021 won't be without its challenges, but we have vaccines, we have treatments, we know what to do. And so we certainly, I think, can look towards 2021 with a bit more optimism. But again, where we had the data, and oftentimes we don't have the data about Black and Brown communities, and it wasn't complete data, but where we had the data, the evidence was clear that Black and Brown communities were disproportionately hit, especially when it came to severe illness, hospitalization, and death. And as I said, this pandemic has certainly highlighted long-standing health inequities. I was reviewing a recent SAMHSA brief, and folks often ask the reasons. And so here are the reasons that there was this unequal impact. But as we think about the reasons, let's also make sure that we need to start to look way upstream. We need to look at racism, structural racism, past discriminatory policies, housing policies, red line policies, Black and Brown communities zoned and perhaps living close to freeways or other environmental hazards. And what happens when you live close to these entities? Your property taxes are lower. And how do we fund our schools? Our property tax basis. So we have to really think upstream when we think about these health inequities, and we certainly need to push back. I heard this early on as people were blaming, because yes, if you had hypertension, if you had diabetes, if you were overweight, if you had past heart disease, you were more likely to have severe illness and death from COVID. And I heard conversations early on about blaming. Well, if you just, didn't eat as much, or you made more healthy, nutritious food choices. And I would always push back on that and say, first of all, the choices people make are based on the choices that they have. And if it takes you, I was on a panel with colleagues from Tulsa, and they just demonstrated that folks who lived in a zip code in Tulsa, he had the lowest life expectancy, and yes, this was a Black community, had to travel 2 hours via transportation to get to a grocery store, to have an opportunity to purchase fresh fruits and vegetables. So we all have to look way upstream. But certainly, if you had an underlying health condition, you were at greater risk. If you were uninsured and lacked a usual source of care, you were at greater risk, more likely to work in service industries, and at a loss of losing income, you were at risk, more likely to live in multi-generational families, and more likely to live and work in those jobs, those essential jobs, required public transportation, but of course did not allow the privilege of working from home. And so we have to make sure we continue to get this data, which is why AMA urged HHS to make sure that data was available. And then when we come to mental health inequities, we see similar patterns. And I do want to say this when we think about mental health, and SAMHSA has a great brief. I love the title, was Double Jeopardy, COVID-19 and Behavioral Health Disparities for Black and Latino Communities. I feel like it's been triple jeopardy and probably more with the incidences of police injustice. Now, in general, and over the course of this pandemic, we've seen Black and Brown communities report increase in symptoms. But if you look overall, look at the big picture, for the most part, the incidence of disease is the same. What is different. What the disparity is the lack of access. Black and Latinx communities have lower rates of access to services. Now, you heard that I chair the AMA's opioid task force, and we also want to raise this disparity, that when Black and Brown communities were struggling with heroin, which is an opiate, our society's response was incarceration, jail. When more middle class and upper middle class white communities were affected by prescription drug abuse, their response was treatment. Now, let me be clear, I am a psychiatrist and I've been advocating for treatment for a long time, so I'm glad to see treatment, but we cannot forget that truth telling that passed. And now we know that if you live in a Black or Brown community, you don't have as equitable access. Let me actually say, no one really has the access that they need for these services, but clearly, if you are Black and Brown, you have less access, often terminate treatment prematurely. Often the treatment is not culturally responsive, as we say. And as we have seen in the last several years, we've seen more overdoses in the Black community related to some of these illicitly manufactured pills. People think are pain pills, but they are laced with fentanyl. And by the way, we have over the last several years seen an increase in the suicide rate of young Black men. But all of these are interconnected to those social determinants of health, those more upstream determinants of health, as I mentioned earlier. And clearly, as a child psychiatrist, we have to make sure that we are keeping eyes on our children, missing school, missing those moments of graduation, and missing being with friends, missing participation in sports and those activities. This has all had a devastating loss, in addition to children losing family members and grieving deaths of family members. And, we have not been able to properly grieve because of the necessary restrictions on our ability to gather. So certainly this has taken a toll on all of us, but certainly taken a toll on our children, which is why I'm a huge proponent of doing all that we can to get our children back to school. And I think the other lesson that we learned, that school is a place that has heretofore been serving many roles. And so we have to look at that as we move forward, and we have to make sure that our schools have the resources that they need. And then again, we know that all children are suffering. And when it comes to African-American and Hispanic children, less likely to visit a psychiatrist or other mental health provider, as I said. And I struggle. I know that folks ask me a lot about referrals for Black or Latinx therapist or psychiatrist. And we know that we do not have enough. And so I believe, and I'm working on a project right now to think about using technology, because we have to sort of have an all hands on deck moment here, and be innovative and innovate as we think about how to make sure that everyone gets the services that they need. And one of the things we also have to make sure is we go to the communities. We needed to do that in COVID-19 and testing. We need to do that in vaccines. Not everyone has a car. Not everyone has broadband access. Not everyone has a computer where they can go online and spend hours online trying to sign up for an appointment. So again, as we think about these overall disparities and inequities, there are some lessons to learn. Now, I did say that, we have to have these conversations about police brutality and police injustice. And as you saw, this is a statement that I co-authored with the chair at the time, Jesse Ehrenfeld, and a lot of reporters said, Dr. Harris, why is the AMA speaking out on this? Why do you care? And we made clear that this is a matter of public health. And I just want you to know, actually, the AMA had policy before this summer recognizing that physical or verbal violence between law enforcement and the public, particularly among Black and Brown communities, are critical, prevalent and pervasive, and criminal at times, and a critical determinant of health. And they do affect the public health. And so at the AMA,
And this goes for every institution, every organization. I know many of you have seen folks make statements, and we made statements as well. But I started out this talk today talking about action. It's what are we going to do? And so the AMA wants to lead by example. And by the way, this is work on an individual level, but work on larger organizational level. And so it starts with policy for us at the AMA, and then we advocate for that policy on the federal level and at the state level. And we also create tools for physicians. And, we are aware, I think all are aware that implicit bias plays a role here. And we are, again, working to lead by example. The AMA Board of Trustees just completed our own initial implicit bias training. We're working with medical schools and thinking about the curriculum. We are, doing things large and small. We are renaming awards. We have looked at our past issues at the AMA, and also because as an AMA, we need to be about truth telling. We want to set an example for others. We launched our Center for Health Equity in 2019 and first hired our first Chief Health Equity Officer. And as you can see on this slide, that 2020 actions included raising awareness about the health impact of police brutality, comprehensive tracking of the data. And this does include zip code data. So we know where to target our intervention. We've had online resources, and we launched a prioritizing equity webinar to make sure that we were getting the word out. I am a passionate advocate of integrating mental health care to overall health care. It's not separate. It's a part. It impacts whether or not we heal from surgery. It impacts productivity on a day-to-day basis, as Leslie said. Now, we need to have conversations. We don't have time to go into all the details, but you can have symptoms of anxiety and depressed mood and feel isolated and all of those things and not have a diagnosable disorder. So, right, there's a spectrum here, and we want to make sure that we are fully respecting the spectrum. But when you need help, we want everyone to seek help. It is okay not to feel okay. And in this time of COVID, I say, here's where we start. You give yourself the grace and the space to feel whatever feelings you have. You try, and by the way, I have gained the COVID-20, but you try as much as you can to get your body moving. You try to get outside, but if not, put on your favorite artist and dance or move around the house. We all need to take breaks from the news and social media. I had to do that here in Atlanta. I'm a huge sports fan, and I wanted to be in the know, and I found myself almost glued to cable news, but thank goodness for HGTV and Sports Talk Radio. Now, we do want to stay connected. We can't hug. We can't have that physical connection, but we are connected by Zoom, although now there's Zoom fatigue and you have to take breaks. Don't forget, I've had a couple of seminars with seniors. Don't forget our senior population. They may not be able to connect via a Zoom or digital. Pick up the phone, some of those old-fashioned things. Volunteer to go get groceries for them, leave them outside. But let's do all that we can to stay connected. For your children, those of you who are parents, create new routines. Have your children be a part of the new routines. Make sure you are balancing their time on social media. I do think we have to think about kids, and hopefully we'll be in person soon, but sitting 6 hours a day on Zoom, I think we need to rethink that. And again, as I said, when you need help, don't feel like it's a moral failing or a character flaw. Don't be afraid to seek help. So I don't know about you, but I was inspired on Inauguration Day for so many reasons, but certainly by Amanda Gorman. And I really loved what she said, because this COVID-19 and the mental health issues and police injustice it all can seem overwhelming, right? And how do we get through this? But I think she gave us a roadmap, right? She talked about this being an era of just redemption, and that folks feared it. We perhaps were not prepared to be the heirs of this terrifying hour, but within it, we found the power to author a new chapter. And so while once we ask, how could we possibly prevail over catastrophe? Now we assert, how could catastrophe possibly prevail over us? And I think that is inspiring to me and should inspire us all to move forward and continue to work on mental health and all of the other issues that COVID-19 has amplified. So again, I thank you so much for your time this morning. And I think I have opportunity, maybe a few minutes, to answer some questions. So here's one. Let's see, why are African Americans still reluctant to see a psychiatrist in 2021? You know, I think, you know, it's history. You know, I've been in church and I have had some great, and this has changed. And I was at a Congressional Black Caucus Legislative Weekend, standing room only audience. I was on a panel with other pastors who were saying we really have to wrestle with this in the church. But I think there's a stigma. People don't want to be crazy. I don't know how many times I've heard, I don't want to see you, Dr. Harris. I'm not crazy. And so whatever someone's definition of crazy is, I don't use that term, but it's negative, I would imagine. And it's not a moral failing. People think we're a character flaw. You just didn't pray hard enough. You know, when you have a diagnosable disorder, this is a brain disorder, chronic disorder. And then when you're just anxious or, you know, have some mood symptoms, it is sometimes just to get an objective opinion, right? And just talk through things. So I think a history, and again, it may not, you know, folks may not be able to find a psychiatrist with their lived experience, which is often important. So those are the many reasons, but we need to make sure we continue to at least do what we can to decrease the stigma. And we're working on our end to increase the workforce, you know, therapists, psychologists, psychiatrists, to increase the workforce of Black and Brown communities, and to make sure that those who are not, right, because I'm not saying if you're Black or Brown, you need to see a Black or Brown physician, but we need to make sure everyone is educated on providing culturally responsive care. Good morning. I have a niece in the Atlanta area. She has been diagnosed with schizophrenia. She has been stable for about 4 years, 3 certificates under her belt. Very good. Let's see, trying to get guidance on getting her a social worker. So, you know, it's difficult for individuals. First of all, let me just say, what a story. Because I think when people hear schizophrenia, they have a narrative in their mind. And so clearly your niece has been stable 4 years, 3 certificates. So again, treatable, not curable, but diabetes is not curable. So treatable, and that's good. I think that it would be a good idea to start with her doctor, whomever is prescribing her meds, and start there and ask them for help regarding your, you know, the social work side of it. That's where I would start with that. Let's see. There's another question. How can we assist our homeless population with mental illness? That is a huge issue. And one of the things I neglected to say when we think about disparities, because we know the homeless is not a homogeneous population, but there's a significant number of folks without homes who have mental disorders. And I will say we turned a corner on this about 3 or 4 years ago with a Housing First orientation. It used to be that in order to get housing, you had to meet all these criteria. You had to come treatment 3 times a week and take your meds and all those things. And I think we changed that paradigm to, listen, we need to get you in a house and we'll support you, because if you don't have stable housing, it's difficult to come to an appointment on a regular day, or, take your meds regularly. So I think we certainly need more resources. We need more housing opportunities, not just congregate housing, but more housing opportunities. Sometimes I think about tiny houses and those sort of structures and villages. That's just something that I've been thinking about, being innovative in how we think about housing. And so I think we're on our journey, but we still have a long ways to go. Let's see. Medication. So someone said child psychologist was quick to refer to a psychiatrist, and medication has ruined. So am I wrong for not wanting to take her? So I'm a psychiatrist, and I understand if you've seen someone else that hasn't had a good experience. But I would say go, because sometimes looking from the outside, you might not know all the nuances. Listen, I'm a psychiatrist, and I'm a physician, went to medical school. That's the difference between psychiatrists and a psychologist. Psychiatrists go to medical school. And I value medication for the right patient at the right time. But it's not always the answer. Sometimes medication, sometimes therapy alone. Listen, let me say something about post-traumatic stress disorder. We are under diagnosing and under realizing trauma in our children. And I could do a lecture all day on trauma. So I know we need to wrap up here, but I would say to your answer, please go see the psychiatrist. Let them know that you're worried and someone had a bad experience. Just be honest. And you may need to maybe try out a couple of psychiatrists until you find one that you are comfortable with and you're comfortable with for your child. So thank you very much. Great questions. And I really appreciate the opportunity to be with you today, and great conference. I'm very excited. Black health does matters more than ever. And we have to do all that we can to make sure that everyone has an equitable opportunity to achieve their optimal health.